This is information about the low potassium diet. Potassium is a mineral commonly found in a variety of foods. It's responsible for normal heart function, fluid balance, proper nerve and muscle function. Potassium is normally excreted from the body through the kidneys. So when a person has a problem with their kidneys, whether it's kidney disease or something else, or they're on a certain medication, that may interfere with the excretion of potassium from their body. If that happens, the potassium in their blood will rise and they may develop hyperkalemia, which is high levels of potassium in the blood. High potassium can be very dangerous and can cause serious complications like irregular heart rhythm, muscle weakness, paralysis, or death. Patients who have hyperkalemia will need to eat less potassium in their diet. Generally, a low potassium diet is defined as 2,000 milligrams or less per day. 2,000 milligrams can also be called 2 grams. Just for comparison, healthy individuals normally eat about 4,700 milligrams of potassium a day. So this low potassium diet is less than half of that. Patients on low potassium diets will need to restrict foods that are high in potassium and also be careful of portion sizes of foods that contain potassium. Here's a list of high potassium foods. I'm just going to point out a few on this list, which are common and that we have on our menu here. Bananas, different types of beef, bran muffins and bran cereal, broccoli, chicken, fish, different types of nuts like peanuts, almonds, potatoes, raisins, tomatoes, and oranges. And sweet potatoes are included as well as white potatoes. High potassium foods are defined as having more than 200 milligrams of potassium per serving. These are foods that are moderate in potassium, so they have anywhere between 50 to 200 milligrams of potassium per serving. Apples, apple juice, applesauce, different types of berries, whole wheat bread, whereas white bread is lower in potassium. Carrots, cauliflower, celery, chocolate, corn, grapes, cucumbers, mixed vegetables, spinach. So again, these are moderate potassium foods that are not as high in potassium. Let's take a look at the 2-gram potassium diet in Health Touch. So here is our patient, and they are on the low potassium diet, which is 2 grams per day. We are going to pretend like we are going to order their lunch. And we'll see up in the corner that they're not allowed to have any more than 2,000 milligrams per day, which is roughly about 666 milligrams per meal. So as we look at the screens, things that are higher in potassium, like chicken parm has tomato sauce, are going to be grayed out. And let's just pretend like we're going to order the pot roast. When we go to sides, the potatoes, whether it's sweet potato or regular potatoes, are grayed out. But there are a lot of options that are lower in potassium for the patient, so guiding them towards those, will help them get a good meal and get enough to eat. So, for example, green beans, yellow squash, carrots, mixed vegetable, rice, roasted vegetable, peas and carrots, the zucchini blend, and carrots and even broccoli isn't very high in potassium. So guiding them toward those will help them get enough to eat. So this patient is going to have roasted vegetables and jasmine rice. For fruits, the pears, applesauce, and apples are the lowest. So I'm going to order the pears. But the other ones could also be worked in if they have enough room in their day. They want some apple juice and a tea. And as we know, if we try to order something that is higher in potassium when they are getting this close to their limit, we will get a warning. And so now this meal is giving them 857 when really it's only recommended to have 666. It's lunchtime. They still have a lot left for the rest of the day. But we should try to stick to the 666 and maybe find them something different like a jello or something to have that's got no potassium in it. So patients should stick to about 650 to 700 milligrams of potassium per meal, no more than 2,000 a day. Try to stick to those sides that are lower in potassium to give them more to eat. And if they get to dinner time and they still have more than the 650 to 700 left in their day, they could have a little bit more at dinner. You just wouldn't want to give them more at breakfast because they could get into trouble and not have enough for the rest of the day.